Respected chairs, dear participants, and faculties from home and abroad, a very good afternoon, evening, or good night to you all, depending on from where you are here. I am Professor Farhana Dewan. I am the immediate past president of Obstetrics and Gynaecological Society of Bangladesh, and I am the Secretary General of SAFOG. And I am really honored to be here and be present in this International Summit on Women's Health and Right, which is one of the very prestigious platform where I'll be talking now for the next 15 to 20 minutes. And I would like to thank Professor Rishikesh Pai, who is the trustee FIGO, Asia-Oceania Federation, and he has lots and lots of accreditation to his credit. He is a very, very good friend of mine, and also we are always together in different conferences, sharing knowledge and also having good times together. So I would like to, today what the topic of my presentation is use of Tentrol to manage labor pain among women in Bangladesh. And it is actually, the name is Tentrol, but it is a TENS machine. I think many of you know about the TENS machine. So I've already given my introduction. And because it is a study, so I am part of the study and part of the team. In the team, we have a person from ICTDRB from Bangladesh and also the Obstetric and Gynaecological Society of Bangladesh. Time to share. So we know that pain management is a very crucial thing in labor and childbirth, although it is highly desired and it has an experience for the woman, but pain during childbirth is described as the challenging and intense pain, and we need to manage the woman. And when we do the management of the pain and the woman has a good experience, we call it positive childbirth experience, which WHO has very rightly mentioned in the updated 2028 guideline. So when a woman has a positive birth experience, she can go for good decision making. She can think about the labor in a good, thoughtful way. And she can also consider, well, she can take future pregnancies. And pain management during labor in our country, in our part of the world, I believe that sometimes it is not discussed so much. And you know that people think, well, it is something which comes with labor. So what is the importance? Pain management gives the woman a sense of control over herself. It alleviates her fear. It improves the perception and reduced pain management enhances the ability to bond with the child. So what are the criteria? WHO has mentioned that provision of pain during labor is a standard of quality care, should be timely done, and it should be also tailored to the culture and need of the woman. So the recommended pain management methods are pharmacological and non-pharmacological. In Bangladesh, we have the pain management system, the health facilities have it, but sometimes due to lack of resource, we are not always being able to implement. And sometimes women think, well, it comes with labor and we don't need to go for management. Among the techniques, we know there's a non-pharmacological and the pharmacological method. Among the pharmacological, the main three headings where we consider these are the inhalation, that is Endorsed, the systemic opioids, and the regional epidurals. Among the systemic opioids, we talk about pethidine, which is very common in our part of the world, but also in the systemic we have ketamine, tramadol, etc. And the regional, of course, we have the epidural anesthesia or analgesia. And in the non-pharmacological, there is a psychoprophylaxis, the hypnosis, and there is acupuncture, hydrotherapy, aromatherapy, a lot of many techniques which are available on the globe, and people are using it in their own country context. And in Bangladesh, we also have some of them. We are practicing some of them, and among them, TENS has come up as one of the methods which can be used in this during this time, and we are trying to make it using it. So we have already discussed the pharmacological is the Endorsed, epidural, and the opioids, and the non-pharmacological among them, we have the TENS machine which will give the pain relief. So pharmacological, they do the loss of modulation of pain perception, and they mainly focuses on pain relief during labor, and so we have to keep in mind whether there is any side effect of the mother or not. And in Bangladesh, sometimes, I'll not say it is not well established, but sometimes in some circumstances it's not being practiced as a protocol, as systematically which should be done. And sometimes the woman also doesn't know whether it will be good to take or not. Sometimes they refuse, and all these problems are there. And they are why there is limited access? Because there is low patient demand, service provision is not always there. There may be cultural consideration, and incorrect technique may be there for some reason. So optimum pain management should balance effective pain relief, and non-pharmaceutical option may be are good to be practiced. They are being practiced in our country, but not very much as such. So what are the challenges of pharmacological pain management options? Number one, they may cause side effect. We know there may be nausea, vomiting, etc. And number two, it may impact the labor progress. For example, it may slow down the labor progress like that. And again, the fetal effect, there is analgesics which can affect fetal heart rate, etc. And sometimes there is lack of trained personnel who will take care of the woman in labor. We know that during labor, we always advocate that there will be a companion, and also along with that, there will be a person who will be managing, who will be with her. And of course, the service provider also has to be there, and limited monitoring facilities may be there. We all know cesarean section is rising, and this is in our country, it is 45% at present. So this is high. If the woman is given a better option for pain, if she doesn't feel the pain, she will never say that I want a C-section. She will say, okay, I'm good with continuing the labor with the pain management. What about the non-pharmacological? What are the advantages of the non-pharmacological methods of pain relief? Usually, they don't have any side effect, less side effect, they are non-invasive, and there is need for specialized training, but not very much. And there is continuous monitoring is also not needed so much. Like if I give the epidural and all, we need to go for monitoring. And it is not so much expensive also. And the woman has I show you intense what happens. She knows how to press the button and control the pain herself. So this is the TENS machine. This is a machine. It is sort of a size of a mobile, which will be in the hand of the woman. And when there is contraction, she will see the contraction. She will see the intensity of the contraction. And if she feels too much pain, she can just press the button, and it will come up, or it will come. The intensity of pain will increase, or that will depend, because the electrodes are kept on the back of the woman, and then she can feel. I'm showing you the picture here. So this is the TENS stimulation. So many of you may have the experience of having the TENS stimulation. Like it is actually, I myself had it once when I had a pain in my arm. So they put the machine here, and it is a sort of stimulation which comes, nerve stimulation which comes, and then they can increase the intensity. If it is more, then they can reduce the intensity. So there are two pairs of electrodes which are attached to the back on T10 to L1. Okay. So low intensity electric stimulation is given continuously or applied by the woman herself as the contraction begins. So when the contraction begins, she can press the button and the stimulation starts. So what does it do? It blocks the afferent fibers and preventing pain to travel from the uterus to the spinal cord synapses. So it also facilitates the release of endorphin. And it has been studied and found that the effectiveness is as good as that of the effect of epidural anesthesia. And there is no risk to the mother and the fetus. So this is what is the mechanism, and stimulates the endorphin, as I mentioned earlier. And there is the brain, mind is diverted, and the woman you can see in the last picture that she can control it herself. So studies have shown that it is TENS is reduces, say it is safe. It is safe and it has been, there is no harm to the mother or the baby. Studies have shown that. And Mama TENS is approved by FDA and is used during labor, is recommended by NHS in the UK. And Cochrane systematic review, there are more than 17 studies and found that no negative consequence associated with the use of it is more or less a natural mechanism. So it tends to manage labor pain has been used over 30 years in different European countries. So now there are some, I can show you some studies here. The RCT is there. This was in Taiwan. They did in 100 women in 2006, and 62% women in the TENS group reported reduction of pain equal to or more than 3. And in China, 326 women were studied, and TENS significantly reduced pain and shortened the active labor. And in Brazil, there was 46 women were studied, and it reduced pain with no adverse effect. Baki? Okay. So in India, they have done a study on 300 women in 2024 and found that it significantly lowered the VAS score at full cervical dilatation for more than 0.001. It was significant. And then in 63 women in Spain, they found that high frequency, when TENS was used with high frequency setting, they reduced pain and improved the maternal satisfaction. So this study has been started in Bangladesh. So what is the, I have already mentioned the title, that use of TENS, and we call it TENTROL, that is the name of the study. Actually, it is the use of TENS machine to manage labor pain among women in Bangladesh. And the objective is to assess the acceptability, usefulness, feasibility, and fidelity of using the TENS machine in selected health facilities. Number 2, to assess the change in the severity of labor pain in health facilities after introducing the TENS machine. Number 3, to assess the change in maternal satisfaction with her childbirth experience after introducing the machine, and to explore only any barrier, whether there has been any barrier. Firstly, we will see the feasibility, and second is to see what is the change in the labor pain severity. Number 3, whether the mother is satisfied. Number 4, whether there are any barriers when we go for implementation on ground. So this is a quasi-experimental study done in 3 level hospitals. One is a public hospital, Rajshahi Medical College. One is the private medical college hospital, that is a Green Life, and it is one of the Upazila, that is sub-district, is a Baliakandi. And pregnant women who are coming to the facility are taken into study, and there is a gestation age 37 completed weeks, and there are some exclusion which have been taken into consideration. So what is the phase of implementation? Here we can see the woman comes from the facility. First, there is the preparatory phase, which she stay in the waiting room, and she goes to exploring the existing pain management practices. She is told about the practices, and then she is told about the TENS. And then it is divided into 2 arms, in fact. So I will show you, this is this. So 140, there are Baliakandi 50, Rajshahi Medical College 50, Green Life 50. So they have been it's not pre-intervention actually, I'm sorry, it should be no intervention. No intervention 25, and like this in every arm, there are 50 people who have 50 mothers who have been divided into 25 no intervention, 50 intervention. So we do the first of in the waiting room, she's given the consent, she comes in labor in fact, and she's given in the no intervention phase, no labor pain is given, and then they see the what is the interview is taken to see the pain score. And in the when the TENS is given, in the waiting area she's informed, consent is taken, and then in the labor room the TENS is introduced to her, and then we are asked about the VAS score. So I've already mentioned this. So here is the VAS score which the woman is asked to fill up. So 0 to 10, you can see that no pain, ranging from severe pain. And we ask about the comfort level. So this is, I would like to mention here that this VAS score is used by the women, and they are actually trained, because we might want to know that, you might want to know from me that what was the result. Actually, the study hasn't finished, analysis is not finished. We have just taken the samples, and now the women have been asked that what is their option and what is their experience. So it has been, we have seen that when we were doing the study, most of the women were comfortable with the machine, and once they have started using it, they become used to. It's not easy, like, that the service provider, the patient, both of them have to be at par with the new technique. So the woman has the machine in the hand. Whenever she feels severe pain, she just put the drop button. If there is no pain, if she's feeling pain, she's put the button, and the drug intensity, the intensity of the relief is more. That is how it works. So I think it is a very important technique, because it is new, because the service providers also, we had to, when we went for the center, we had to tell the service providers, Cholo. We have to tell the service providers that, yeah, this is the method, this is how it will work. Please try to understand, and any queries you ask us, because we will not be in the center when they are doing it. But of course, some of us will be there. Some of us were there when they were doing it, so that if any problem, because the sample size is so small. So I think that this is. I have explained the whole thing to all of you, and I think you will understand that this is a very. It might be because it's not only new in our country. It has been used in other countries, as I showed you the evidence. So it will be promising for our country as well. So I would like to thank you very much for patient hearing. And before finishing, once again, I would like to thank Professor Rishikesh Pai for giving me this great opportunity to present in front of all of you. Thank you so much.
Thank you, Professor Farhana. It's a totally new thing I've heard. So, very good for the summit. I have, of course, I'm more into IVF and reproductive endocrinology, but I've got other colleagues of mine, and it's really new concept, and it's good for our listeners. There are nearly 3,700 registrations and 1,900 online. So, Zeel, would you like to now take over the questioning?
Thank you.
Good afternoon, ma'am. So we have a few questions from the audience, if you could address.
Yeah.
As you said, as you know, the woman will press the button and the drug will be delivered. Can you enlighten us as to what's there in the pump, which kind of drugs are used?
These are, the pethidine. Sometimes we give the analgesics or we give the pethidine. It's just the drug which is commonly used in our country. These are the drugs which are given.
How can one, get this machine, the TENS machine, if they want to use in their setup?
Okay. So in our, madam, in UK and those countries, it is in the package which the midwife, their system is different. So when the midwife comes to the woman in labor, the midwife demonstrates that this is the thing you can use, these are the options you can have and you have and all that. But in our country, because the study has started with ICTDRB, at present ICTDRB is providing the machine to different centers, the centers where we have started. But if it scales up, like in any program, we have a pilot and then we have a scaling up. So if it scales up, then they will make it available in large scale.
Madam, is it like a IV pump, and you have to have a pump? How does it deliver the medicine?
The medicine is actually, this is the electrode which is put in the woman's seal. And the TENS machine, I have myself used the TENS machine. The TENS machine is a machine and they put the electrode on the hands. So it comes as electric current. So you get a sort of sensation. So this is sort of sensation which is given and the woman can feel the pain.
The question has come from the audience.
So one last question.
I wanted to ask a question. So with this machine, have you seen a better outcome in terms of decrease in the cesarean rate? What are the early findings coming out with the
Oh, actually, sir, Rishikesh, it is too early to comment because we have only started it, only 150 clients, na? So those people who have used it, the result is good. But now we'll have to wait a bit to scale it up. Only 150 clients.
Last question, ma'am. So when you are using the TENS machine and this kind of pain relief for the laboring patients, do you require anything extra in terms of monitoring, or what you are doing otherwise suffices?
No, what we are doing otherwise is all that enough. It is enough because we have got everything to monitor the woman, whether the fetus is okay. We have the CTG machine, we have the ultrasound machine, and everything in place to monitor them.
Thank you so much.
Thank you,
madam, for
madam.
sparing your precious time, and we are looking forward to meeting you now. The SAFOG meeting is there in Sri Lanka.
Yeah.
You and Professor Sham Desai, the president, you are the Secretary General. So we are looking forward to meeting you, and then looking forward to meeting you in Cape Town, where our conference is there, and we are all
Yes, sir.
waiting to meet all of you. Thank you
Thank
very
you, sir.
much.
Thank you,
And
sir.
we would like to say hi to our friends in Bangladesh and give our greetings to them.
And I would like to thank both the chairs here, including yourself, and of course the audience. I can see the audience, but I'm really grateful to be able to speak now. Thank you so much.